one evidence of governance would be how we rolled out the Affordable Care Act. It is intact. It's beautiful. As with everything, it's a work in progress. We need to improve it. But the website didn't work, and now it's well. And we go forward.
That's our dear Nancy Pelosi saying how beautiful Obamacare is. Really, Nancy? Are you kidding? What are you smoking? Do you think it's beautiful to all the people who lost insurance, doctors, and ended up on a website that didn't work? With me now, Democratic strategist Richard Fowler. All right, Richard, is Obamacare beautiful?
Well, happy Saturday night to you, Judge. And yes, the Affordable Care Act is working. Listen, I got you. The website didn't work as well as it should have. We had some hiccups here and there. Some folks lost their health care insurance. But if you look at the headlines now, folks are finally getting health care coverage. Folks are finally getting a chance to go to the doctor. And that, Judge, is a beautiful thing.
So you're smoking it, too. You go through Colorado lately? Let me ask you this.
I did not go through Colorado lately.
Richard, let me ask you this. People lost their health insurance. They can't see their doctors. We've had cancer patients with terminal illness who can't get to a doctor. You seen the mess with the VA healthcare system. How can Obamacare possibly be beautiful?
Because it's two different things, Judge. The VA system is
government-run health care.
No, well, wait a second now, Judge. So in the VA, it's all the means of production, the ownership of the policies is through the federal government. On the Affordable Care Act, the exchange is run by the federal government. Once you purchase health care insurance, you purchase it from a private insurer, Blue Cross Blue Shield, Aetna, Kaiser Permanente. Those are private companies servicing your health care, and that's what makes the Affordable Care Act work so well. That's what Mitt Romney passed it in Massachusetts.
But stop with the Romney thing and the Bush thing. Okay, but here's the thing, Richard, that once the government says you cannot have your doctor, you cannot keep your insurance, I've got to pay for your mental health, I've got to pay for your transgender operation, I got to pay for 12 million illegals, I have to pay for all this. Well, how can it possibly not be something that is a disaster? If we can't get doctors to work for the VA, how can we possibly get doctors to cover everybody else?
Well, there's a distinction here. The doctors that work for the VA get their paycheck from the VA. These doctors that are part of the Affordable Care Act get their check from the private health care insurer. And, I mean, the fact that we allow for more coverage, whether it's for transgendered surgery or for pap smears or for mammogram screenings, is a great thing. The fact that folks can finally go to the doctor is a good thing,
let me tell you something.
Judge
I don't
Jeanine.
need prenatal care. The chances of me having a baby are slim to none. Well, then she gets her insurance. And the same
Which she gets through the Affordable Care Act.
Let me ask you something. Do you need to have insurance for postmenopausal syndrome?
No, but I need insurance if I have to get my prostate checked, Judge.
But the point is, you're paying for insurance for something else. Okay, VA scandal. Let's talk about this, Richard. It's proved once again the administration either doesn't know what the hell it's doing or just lies about it. How can the American people trust anything that they say at this point?
Well, listen, I got to tell you, on this one, Judge, I agree with you. I think the VA has been in trouble for a long time. Since Harry Truman till today, our VA has the same exact problem. And the question now, and I think what this president's hyper-focused on, is how we fix it. It's not about firing one person, it's about how we fix this for all of our veterans. And I think that's where the president's focus, and that's where the American people's focus should be on this one.
Richard, I'm not even going to comment, but we always love having you on. Thanks so much for being with us this evening. All right. And now the results of tonight's Insta poll. Should veterans be allowed to get health care at private hospitals? Elizabeth says yes. Why do they have to be second-class citizens? Steve says absolutely. Illegals do. Sharon says yes, as long as they're not dumped into Obamacare. And William says yes, privatize VA hospitals. The government has no business running them. And Jean says, yes, get rid of the VA and the government will save money on bonuses. By the way, the government shouldn't be giving bonuses to anybody. And finally, Jolene says yes. And in addition, vets should be allowed all of the benefits to which Congress thinks it's entitled. That's it for us tonight. Thanks for joining us. Remember to friend me on Facebook. Follow me on Twitter, Judge Jeanine. See you next week.